Namaste. Welcome to a brand new session of WebCares, the health awareness initiative by the Women Entrepreneurship Platform of Niti Aayog. Web was created with a bold vision to enable women across India to dream bigger, build sustainable businesses, and support each other through shared knowledge, network, and resources. But empowerment is not about access to finance, markets, or technology alone. It's also about reliance, preparedness, and the ability to act when it matters most. Apollo Hospitals is proud to partner with WEP to create this awareness and ability for each one of you to address issues of health and well-being. And that's why today's webinar, Minutes Matter, First Aid Basics for Medical Emergencies, is so vital. I am Dr. Srinidhi Chidambaram, consultant in public health, clinical outcomes, and health communications at Apollo Hospitals, and I'm delighted to present this session to you. As entrepreneurs, you're constantly making quick, high-stakes decisions. But what if one of those decisions was about saving a life? Someone near you suddenly collapses, becomes unresponsive, or starts showing signs of distress. We hear about heart attacks every day at work, often occurring without warning. Person begins to choke, someone trips and sustains a head injury. There's severe bleeding. Many medical situations demand more than just concern. They need calm, confident, and correct and timely action because the first few minutes can often determine the outcome. You, as entrepreneurs and women leaders, lead from the front, navigating the demands of business, work, teams, home, families. You help in shaping communities, whether it's your employees, whether it's your loved ones, or those who count on you every day. You're often the first to step in when something unexpected happens. But what if that moment is a medical emergency? So you could be the first responder before professional medical help arrives. So equipping yourself with first aid knowledge is not just a personal asset or an achievement, it's a business continuity skill and a leadership tool as well. So today we are going to discuss this very important topic of minutes mattering a lot and what to do in medical emergencies. You all must have read enough about the first hour after a heart attack, known as the golden hour. Rapid interventions can dramatically improve survival. Life can be lost within 4 to 6 minutes due to a cardiac arrest. You know about strokes. You know about how every minute counts in saving those brain cells. You know that time is brain. A delay of even 1 minute can result in irreversible brain damage. Every medical emergency needs specialized knowledge. And so this webcast session is thoughtfully curated to empower you all with that practical life-saving knowledge and readiness. And we hope that this session will offer you those clear, actionable guidance for handling common medical emergencies. I hope you have the confidence, the skill, and the presence of mind to act quickly, calmly, and correctly after the valuable insights provided by our expert in this session. I am honored and delighted to welcome one of our most renowned emergency specialists in the Apollo Group, Dr. Nitin Jagasia, to share valuable insights on this topic. Dr. Jagasia is a UK-trained emergency medicine specialist with over 20 years of experience across leading healthcare systems in the UK and India. He currently serves as the Regional Director Emergency at Apollo Hospitals for the Western region and heads the Emergency Medical Services at Apollo Hospitals, Navi Mumbai. Post-MBBS, he moved to the UK in 2003, completed his training in emergency medicine, and then worked as a consultant and trauma lead at the University Hospital Southampton. After returning to India in 2015, Dr. Jagasia led emergency medicine at several hospitals such as the Reliance Foundation Hospital before joining Apollo in 2016. And since then, he has played a pivotal role in strengthening our emergency care delivery systems across Apollo's Western region, led the development of several clinical protocols, JCI accreditation efforts, and establishing advanced training program. Dr. Jagasia is especially wonderful as a committed educator, and he serves as a guide for both the DNB Emergency Medicine and MRCM courses in the UK. Is a course director for ACLS, BLS, and ATLS, certified medical simulation instructor. So I can't think of a better person to guide us through practical steps in all medical emergencies. Thank you so much, Dr. Jagasia, for joining us today, and welcome to this session.
Thank you.
So let's begin by first understanding this term that is often spoken about, the golden hour. And also let me tell you before we begin that, you can put in your questions on the chat box as well, and we'll take them up at the end. And we have also received quite a few questions from our participants, and I will incorporate them as we go along. But first, let's begin by asking Dr. Jagasia, what is the golden hour, and in which medical emergencies does it play a key role?
Yeah, so I think the term golden hour is quite apt, and it is well known that there is basically what it stands for is any time critical intervention. So if any emergency, any medical condition which is time dependent, so like you've already mentioned, there's a heart attack, there's a stroke, there's a head injury. So there are valuable minutes where those interventions would make all the difference on a full recovery versus a partial recovery versus actually no recovery at all. So that is what the golden hour stands for. There is also a term called platinum 15 minutes. So it's basically just a sense that getting the right kind of treatment at the right time is going to make the difference. That is what golden hour stands for. And it will be very different depending on the emergency. It could be, like I mentioned, it could be a few minutes. You mentioned 4 to 6 minutes for the brain. If it loses oxygen, for some emergencies, it may be half an hour. Some it could be a bit longer as well. But it's actually the decision making that happens in the first few minutes after an emergency, primarily as a layperson or a bystander, and then reaching to a facility which is actually equipped to deliver that intervention for the patients that need it.
So, what do you think exactly that a layperson, of course, we will discuss some of the common medical emergencies as we go along, but
Yeah.
what should, so I would like to dwell a little more on this point that you raised about where do you go, what do you do? Because sometimes when these kind of things happen, we are all kind of stuck and in a
Yeah.
kind of a panic situation. So what exactly should be done? And there are so many hospitals and so many there might be different levels of care available. There might be a small neighborhood clinic, for example, or there might be a small nursing home, or there might be a large hospital. So many times people are confused and they think they should go to the nearest place rather than a place where all facilities are available. So how should one choose a hospital, and what's the merit of actually choosing some kind of the transport itself rather than trying to drive a person or hail a taxi? So if you could just enlighten us on what people must do.
Sure. So I think you've rightly hit on that the variability or even unfortunately inconsistency that is available in healthcare in India is the real challenge. And for a layperson to actually get through that, when you're panicking, your loved one or your friend, family has had an emergency, or you think they're having an emergency, in that panic situation, to be able to wade through which is the right place, it would be quite challenging. A few pointers that I could help with is obviously preparation, prevention. So we all, work in a particular place and we live at a particular place. So actually having our local knowledge, which is the nearest, you know, facility that might be needed. Like there are some terms called a heart ready hospital, a stroke ready hospital. So you would be able to identify them. There is the social media now, there is online stuff, there is the newspapers. So being aware that, okay, if there is an emergency of this kind, if I feel that my friend or family is having a stroke, which is my stroke ready hospital, at that time going to a smaller facility or a facility which you're not sure about. So doing a little bit of that homework, preparation, prevention is actually what is going to help you in that moment of panic. Certainly, you could rely on the big hospitals, which you know that have all the specialists under one roof. Emergency medical services now, over the last 12 to 14 years, now it's a separate specialty in India. So just like a doctor trains after their basic graduation in MBBS, they train to be a neurologist or a psychiatrist or a trauma surgeon or a physician. There is an emergency physician now. These are people like myself who are trained in that golden hour. We are trained at identifying whether it's a newborn or a 99-year-old, whether it's a fever, whether it's a trauma, which are the ones that are actually going to be needing immediate care and what care they would be needing. So it all starts with the ambulance service, like you mentioned. So again, the ambulance service is inconsistent again. So having a number, having some kind of awareness that which is the ambulance that is actually going to turn up, and if required, being able to deliver the care. With technology now, we have 5G ambulances as they are uh, called now, which are actually connected like how we are connected today. We can see and we can talk to the patient through webcams and through internet, and we can guide the team inside the ambulance as well to start particular treatments. So being aware that if there's a 5G ambulance in your neighborhood, and what is the contact number, and trying and testing them out, just like you would do other drills. I'm sure in the corporate world you would have regular drills on fire and other kinds of safety drills. So actually doing a kind of a drill, does this ambulance actually turn up? Or when it turns up, what is inside? Do they have all the equipment? Are they linked up to the right hospitals? If you have a 5G setup, perfect, but obviously that's not going to be everywhere. So actually being aware that ambulances do start care on the roadside or on the bedside. So that would be needed. One additional thing I would add to this layperson thing would be actually getting yourself trained, or if you're an organization, you would have specific people trained in your unit. We call it at Apollo a lifesaver program, which is nothing more than a 3-hour first aid training program where you are given hands-on skills with all the scenarios that you mentioned, whether it's a fall with a head injury, choking, identifying cardiac arrest, doing the right thing, seizure, or a fit as we call it. So all those things are bundled up called as a lifesaver. So having identified first aid professionals, there are other organizations also which conduct these courses, but actually having a splatter of these people within your organization or within your building society, where you would have these people who can actually jump in and support, because you may not always know what is to be done. So people who are really keen should get themselves trained and refresh their training at least once a year, so they are confident and they don't panic. I would just like to use a simple example. Like, for example, if you have a trauma patient, the first aid would be don't move that patient unless you have to. Whereas if you have somebody with a seizure, then their breathing, their airway, as we call it, their mouth would get obstructed, and you need to actually turn them on the left hand side so their airway is open. And if you have a stroke patient, it doesn't really matter whether you move them or not. So how do you differentiate whether you touch the person suffering, whether you touch them, whether you turn them, don't turn them? So you need that little bit of training for your confidence. And as an organization, you should have that kind of an emergency response system. So you have 4 or 5 individuals, they are there at any given time, they know which ambulance to call, they are aware of your first aid kit, what equipment you have, and they'll be aware of which is your facility. So, sorry, I might have gone over, but
No, no,
it's an entire system
very
that you need to create.
absolutely. I think now we will talk a little bit about some of the most common and life-threatening medical emergencies. And I think one thing which everybody is familiar with is the cardiac arrest, and we have a lot of news about it, and everybody is scared of it. But then again, questions that would come to our mind that we need to know is, how do we recognize that it is indeed a heart related cardiac arrest thing? And I would be really grateful if you can show our viewers some basics of the cardiopulmonary resuscitation and a bit about where the AED device to be. I know that many workplaces have that, but we need to know when and how to use it. So these are some of the things related to the heart that I would request you to discuss now.
Sure. So I think cardiac arrest may sometimes be confused with a heart attack. So they are two entirely different things. Heart attack is actually a blockage in a blood vessel supplying a portion of your heart, because of which that portion is not pumping properly. But the person is actually talking, breathing, maybe unconscious, but they'll be breathing and the heart is still pumping. It may not be adequate, but it is pumping. Cardiac arrest as it sounds, is the heart has arrested, it's not pumping. Once it's not pumping, within a few seconds to a minute, you will stop breathing and there'll be no breathing. So, cardiac arrest, there is no pumping and there is no breathing. So, in simple terms, you will not have a pulse and you will not see the chest move. That is how you identify a cardiac arrest, as opposed to a heart attack. A heart attack, people might be clutching to their chest, they may be sweating, but they may be making some noises, but they'll certainly be breathing. And as some of us have a habit, you could feel feel the pulse, but the place to feel it is in your neck, whether there's a pulse or not. So that is the crucial difference. Is first knowing whether there's breathing and a pulse. If there's a breathing and a pulse, it's not a cardiac arrest. And then the management is like a medical emergency where you need you need somebody trained or an ambulance to then take over. There wouldn't be much else if someone's having a heart attack unless you're trained. There are medications, there's other things, but I wouldn't go into that. But if there's a pulse and breathing of any kind, you want to put them in an ambulance, take them to a center which can look after all types of heart conditions. If there is no pulse and no breathing, then they are in cardiac arrest. That is where you start CPR or cardiopulmonary resuscitation. And it is about what we know, it is about pushing in the chest. I will just do a demo in a second. What I'd like to tell you about cardiopulmonary resuscitation is you just need two hands. You don't need any equipment. You need a bit of training to give you your confidence to do it. But anybody can do it. They don't need to be literate. They don't need to be specially trained in any way. They just need to know that it's in the center of the chest, and you need to push down, and you need to push about 100 to 120 times a minute. So obviously, unless you've done that training, typically on a mannequin, you would not have the confidence that you're doing it properly. Complete CPR, as they call it, would be actually giving the person mouth-to-mouth breathing as well. Especially with COVID and other things, we are all worried about infections. So if we choose not to do that, even just chest compressions is, very, very important and very, very critical. And world over, that has been signed off that if you're not sure, you're not confident, don't do the breaths, just do the compressions 100 to 120 a minute till the advanced help arrives and they take over. So what I'd like to do now is I will just show you a mannequin and I will show you about the CPR. When I finish with that, I'll talk about the AED and then demonstrate the AED. Is that okay?
Absolutely, doctor. Thank you.
So if you have somebody in a cardiac arrest, obviously you will be on this side. This is what I was talking about, no pulse and no breathing. So we would be examining on the neck, on one side of the neck. You're pushing down and you're feeling for your pulse. And at the same time, you tend to look that way. So you can feel the breathing on your face and you can see the chest moving. So you do this for 10 seconds. And if you cannot feel any beat over here and you can't see the chest, the patient or the victim is in cardiac arrest. That is the recognition. The minute you feel there is no pulse, there is no breathing, you need to activate a response so that somebody is calling the ambulance, somebody is getting advanced help. And then you promptly jump onto the chest, which is the center of the chest, and you'll be pushing down. So clearly you'll be doing this 100 to 120 and you will get tired. So if you have other people, you can immediately call them, take their hands and you can actually guide them live if you are trained. So that's what I meant. You just need two hands. Now, coming about the breathing. So typically you would have to turn the head back so that the windpipe opens. So they'll be lying like that. You just turn it up. You'll open their mouth and you would blow into the mouth. If you're trained, you could have what is this is a one-way mask. So you don't actually, one-way valve. So you can put it on top and you would breathe through that. So you're not getting the infection and you can give the breath there. If you're trained and if you're willing to do this, then what you do is 30 compressions on the chest, 2 breaths, 30 compressions, 2 breaths. So that would be the complete CPR. So I'm just going to do a quick recap. First, you need to make sure they're in a rest. So you feel their pulse, you feel for the breathing, and you look at the chest. 10 seconds, no pulse, no breathing. You need to start compressions. And if there was a pulse, breathing on, then what you do is you turn them to their side, called the left lateral position, and you wait for the ambulance.
I think next, thank you so much, doctor. So I think we will also show them the AED
Okay.
because that's also part of this whole thing. So we'll finish that off and then.
So if you are in a cardiac arrest, sorry, if the victim is in cardiac arrest and you are lucky to have what we call an AED, it's called an automated external defibrillator. These are generally kept in a red bag, and they are now positioned in all malls, all airports, and various large places. And again, this is part of the lifesaver that I spoke about, but it is even something you could look off the YouTube or anywhere. And I'm just going to show you that now how easy it is. Inside the bag, there are basically just two things. There are these sticky pads. Okay, as you can see, the arrow is telling you where to stick it. This is one of them, and this is the other one. Okay, and then there is this device. Now let's see how this goes. So obviously it says 1, 2, 3. This is a training one. That is why it's got this message. That is not for patient, not for care. So first button, obviously you just push it on. Try. You can see the flashing light. It will only go one way. You can't get this wrong. You literally, once you push it in, sorry. Right patient's chest. Plug in pad connector next to flashing, analyzing heart rate. Do not touch the patient. Shock advised. Charging. Stay clear of the patient. Deliver shock now. Press the orange button now. Shock delivered. Start CPR. So as you saw that, it actually talks you through all the steps. It is what the shock is for is a very specific condition. So when you're in a cardiac arrest, if it is because of a heart condition where the heart is in a funny rhythm, this machine would recognize that. And the treatment for that is the shock. And it is a very high success rate. If it is given within the first few minutes of that funny rhythm, the heart will start beating normally. You will start getting a pulse. So it actually tells you, as you heard, you just have to switch it on, tells you where to put the pads because it says on the pads where you're supposed to stick them. You push it in and it tells you to stay clear and it will tell you. And if you're in a position where it is 3, 4, 5, 6 minutes, it will keep talking to you because you're supposed to check the rhythm every 2 minutes. And it will count, it will tell you stop or stay clear of the patient, analyzing rhythm. And if they need to give a shock again, they'll make you give a shock. So that is why it's an automated external defibrillator. It's for cardiac arrest when the heart is in a particular rhythm, which it would shock it out of.
But is this something which lay people can, how would they know when to use it?
In cardiac arrest. So even if they don't have that, the machine will not give a shock. So you will not do any harm
Yeah,
by
okay.
using this in a cardiac arrest situation.
Okay.
The times you could even actually, if you put it on a patient who's not in cardiac arrest, it won't give a shock because that rhythm is not compatible with life, which you have to give a shock. But
Right.
definitely, if the ideally you want to recognize cardiac arrest, no breathing, no pulse, get this device, stick it on, and it will tell you. And if the rhythm is not shockable, it will just tell you continue CPR, which would be your chest compressions plus or minus mouth to mouth if you want to give it.
Absolutely. Thank you, doctor. So I think we
Welcome.
now move on to the next emergency. Let me quickly check if there are any questions meanwhile. No. So choking is another one where uh, there is a way to tackle that. So what is the danger in choking, and what mistakes do people make normally, and what is it that they're supposed to do actually? Like, could you explain that?
Yeah, so choking is basically, as we know, we have two pipes. One is the food pipe and one is the wind pipe. So choking would be if something goes into your wind pipe and you're not actually able to get oxygen or getting air into your uh, wind pipe, and you would obviously, without oxygen, you would stop breathing and your heart would then stop. So the universal sign, your patients tend or victims tend to hold their neck in this way, and they would be going blue in their face because once we lose oxygen in our blood, we tend to go blue. So this would be a universal choking sign. Um, you, while the person is responsive, while they are actually trying to respond to you in whichever way, which means they are not unconscious, encourage them to cough. Coughing is the best thing. They will try and dislodge it by just coughing it out. And if they can do that, occasionally they may aspirate or they may pull it into their lungs, which will still open up the other lung or other side of the lung, and they would be able to breathe. But while they're responsive, you just keep encouraging them to cough. Obviously, you would be probably making your way to an emergency setup where they can further evaluate. The question is if they go unconscious. If they go unconscious or they are not able to speak at all, they go very blue. There's something called a Heimlich maneuver. It's after the person who discovered it, but basically you're creating pressure inside the thoracic or the chest cavity of the victim and helping them cough it out, and that is called the Heimlich maneuver. It is the same for adults and children, other than infants. So less than 1, maybe up to 2 years, the maneuver is slightly different. Above that, it is all the same. Again, I would use the mannequin and show you that quickly. So this would be, if you can imagine, this is the person currently choking or not able to breathe properly. You need to be behind them, and you would actually be lower than them. You won't be standing up, so you may have to kneel down so that you're below them, and you would have the hand in the form of a fist just under the chest bone, and with the other hand you'll be pushing in, and you hope that they cough it out. So you've got a fist just under the chest bone, other hand, and you're pushing it in, and you're below the height of the patient, whether it's an adult or a child. With infants, I don't have an infant, but it will almost be the opposite, and you're giving chest thrust at the back.
Right. Thank you, doctor. Another life-threatening emergency is likely to be a bleeding, but again, there are different levels of it. And when does it become life-threatening? And there are a lot of beliefs that you apply pressure, you tie it up, or you try to kind of hold it under water. So, what exactly should be done for any kind of bleeding? Or does it also depend on which part of the body it is coming from? Is it internal, external?
Yeah. So internal bleeding, of course, none of us can do anything.
Yeah,
We like
have
you're
to.
bleeding inside because of some injury, or even because of ulcers. Sometimes you have a lot of bleeding. There you would have to have a surgical intervention, whether in the form of a camera called endoscopy or a surgery. But external bleeding, by and large, it is compression. So if you've got a wound on the head, or you've got something on the arm, you can definitely apply direct pressure and elevate it above the heart. So the blood pressure, the circulation comes down a bit. So it is about putting direct pressure and elevation. If it is what we call a fracture or a broken bone associated with that, then you can splint it. So you can find a big long wooden stick or whatever you can find. You can just put it there and tie it around. Um, if we are talking about tying what we call a bandage around it, there is something called a asymmetrical pressure. So if you can imagine, if I just put a bandage all the way around my hand, it will be a symmetric pressure on the entire circumference. But what you want is an asymmetric pressure. So you can just use a piece of surgical gauze or dressing. You fold it up and keep it on the bleeding point and then tie the bandage. So there'll be more pressure on that point compared to the rest. So that would be the first stage. So you put direct compression, then try and do an asymmetrical pressure bandage, elevate, and of course, depending, you need to seek medical help. When does it get dangerous? So obviously it depends on the amount of blood you lose. So you can lose blood very quickly if you've managed to injure an artery, which is the pumping part of the heart, where the blood pumps out, and that will bleed a lot. Whereas the veins wouldn't, and you'll be able to get control by pressure. We've got a very good blood supply on the scalp, so that is why on a head injury you will get a lot of bleeding, and the way the structure is, the tissues are difficult to come together because of how it is made. So that again, their pressure and getting medical help is what it would be. More and more these days, we are on a lot of medications that thin our blood. So being aware of that. So someone who is on a blood thinner, either because of a heart condition or there's a clots, you must be aware of. In the flights, we are told about the deep vein thrombosis or clots in the legs and lungs. So people might be on blood thinners. So if they are on blood thinners and they're bleeding, again, you may not have bled a lot, but it may not stop. So seeking medical help. But the initial treatment is the same: compression, pressure, and elevation, along with getting to a hospital.
Right. We'll now move on to stroke, doctor. So this is something which again people are confused about. So what would be the suspicion? When should one suspect that somebody is having a stroke? And we've heard about uh, mechanical thrombectomies and thrombolysis and all. Again, as we already said, time is brain. So what should one do? What should one, if you can briefly tell us how to react? And how to recognize it. I think stroke is one of those things which is not so obvious as the choking or the bleeding.
Yeah. Yeah, absolutely. And I think stroke, we are quite infamous. So as a country, we are the diabetic capital. We are the hypertensive capital of the world. So all these are risk factors for strokes, and we are seeing more and more strokes. And unfortunately, again, you're right that recognition is a real problem. We are not seeing these patients early enough to make the difference, and it is a huge impact. So I'll talk about recognition and then about the time frame. Recognition wise, there is a mnemonic called Be Fast. So that is what people first we used to call it fast, and essentially it stands for B is for balance. So at any time you suddenly lose your balance, E is for eyes. So your vision, whether it's blurring, whether you can't see any kind of visual disturbance. F is for your face. It tends to drop to one side, is one of the signs. Um, A is actually for arm weakness, but it can be arm or leg weakness, any weakness of any part of your body. And S is for slurring of speech. So your speech is not clear or you're not able to pronounce certain words. That is speech. And T is for time, time to get to the stroke ready center, wherever they can actually, they have a full service available to do various things, which I'll talk about in a minute. So I'll just repeat that: balance, eyes, face, the deviation, arm or leg weakness, slurring of speech, and T for time. Any of these, you don't have to have all of it. Any one of these features, yeah, any one of these features happens suddenly in any age group. Unfortunately, we are seeing younger people getting it. It used to be more in the elderly, or we don't call them elderly anymore, even at 60. So 65, it was there, but now it's happening in the young people. Children are not exempt. Children, unfortunately, also can get a stroke. Uh, Stroke, basically, just like a heart attack, is a blockage. It is a blockage in a blood vessel supplying blood to a part of your brain. So if that part is controlling your left side of the body, your left side will stop working. So that is what it is. It's a blockage. So we need to get rid of that blockage in a timely fashion. So if we recognize balance, eyes, face deviation, arm weakness, slurring of speech, we need to immediately get to a stroke ready hospital, and make sure that it's not a stroke. If it's not a stroke, great. There can be other conditions that mimic it, but we should never try and say, okay, we'll watch it for half an hour, we'll give a bit of lime juice, sugar juice, let's do that, just have a sleep. We've heard all of this, but if you have these features in anyone around you, get to a stroke ready hospital. Why? Because there is a time frame, and this is what I mentioned at the start of the program. We are lucky with science. Now the medication that we can give is licensed for 4.5 hours from time of onset. It used to be 3 hours. Mechanical thrombectomy that you mentioned is up to 24 hours. Now I'll tell you the difference between the two. And of course, not everything in medicine is applicable to everyone. So few of us will have the same condition, but it may or may not be indicated. And that is where stroke ready hospital makes the difference, because they have got rid of the hurdles. They have the specialist round the clock. They have the emergency physician, neurophysician, MRI technician, MRI radiologist, mechanical thrombectomy consultant. They are all available 24/7. They have a protocol. Patient turns up, I'm having trouble with balance, everything kicks in. I'm having trouble with face asymmetry, everything kicks in. And everything is timed, because we need to get, like you mentioned, time is brain. So we need to make sure we are doing all of these things in the scientific, time critical manner. 4.5 hours that I mentioned was a medicine. It's a medicine that goes into your drip and it breaks the clot down. And that is up to 4.5 hours from onset, not from the time you reach the hospital, which is where it gets critical.
Yeah.
Every half an hour, 1 hour delay, you're eating into that time. We need to get an imaging. 15% of strokes are because of bleeding. If there is a bleeding, as in the blood vessel, instead of a blockage, the vessel ruptures. If it ruptures, there is no, then the time limit is not for the treatment of the clot busting medicine, it's for other things. So you still need to get there. But 85% of the time, it's a blockage where 4.5 hours, we may be able to use that medicine in the right cases, and it will make a huge difference. As you can imagine, blood supply restored to that part of the brain, function returns, and you won't have that disability. Otherwise, you would have that. Thrombectomy is what you can relate to in what you've heard as stents in the heart or angioplasty, which is basically actually going inside and taking the clot out. That is the thrombectomy part, which is an intervention. It is not indicated in all strokes, but it is indicated in strokes, and its outcomes, obviously, as you can imagine, if you can get rid of the clot, the circulation again is restored. So it's an absolute, necessity to know your stroke ready hospital, for you as a layperson to recognize, be fast, and even if you're not sure, it is better to seek that help. And the hospital telling you, don't worry, relax, it's not a stroke. But getting there in that timely fashion to the right facility is absolutely key. And I'm sorry, I'll repeat myself. We are seeing a lot of these very late.
We have two questions also, which is about the previous thing. So somebody is asking if there's any age or health limit, like if somebody has asthma and all that, if they can give CPR to the other person.
You can give CPR. Like I said, it's about hands. As long as your hands are not dirty, you can give CPR. Mouth to mouth, it is only infectious diseases as we call it. So if you've got active tuberculosis or you have HIV or something which is transmitted through secretions, obviously you should not be giving mouth to mouth. But for chest compressions, there's absolutely no restrictions as long, mouth to mouth would be the only place where certain infectious diseases which you would know of. Asthma is not, I cannot give you asthma. An asthmatic can't give you asthma. So asthma wouldn't count in that. There are certain infections, like I mentioned, where you would know and you would already be taking those precautions. That is why you don't do mouth to mouth, but for not for compressions.
I think emergencies are such a vast topic that, I don't know whether we'll have time to cover all the emergencies that we plan to talk about, but we will still discuss a few more of them. So, another common workplace uh, emergency is this whole panorama of accidents. So, it could be like burns or electric shock. Fainting is another one that often happens, which is again a wide range of causes for it. So, do you think we can discuss some of these together? Like, there's often a lot of ignorance about how to handle burns, how to handle electric shock. So, there's always this question of, apply things on it or put the cloth around. So, could you briefly tell us about handling burns and electric shock, and then we'll come to fainting?
Yeah. Burns, definitely not to apply anything other than cold or running water. Definitely no ointments, nothing else. First thing is get rid of the thing that's burning it. So if there's a cloth or something else in contact, or if it was a chemical, you wash it off, and then the burning process continues for much longer. So typically, first aid would be 10 minutes under a running water is the ideal thing. So if you can just put the burning, whatever part of the body is burning, if you can pour running water or put it under the tap, and then you just get them to a medical facility for a even a clinic or something where they can assess the depth of the burn, whether it's superficial or deep, and then the healthcare provider there can apply whatever ointment and cover it or refer you on depending on where the burn is, but definitely not applying anything on it. Covering it wouldn't be wrong, obviously, because it's very painful because the nerve endings are exposed. So if you've got a first aid kit and you're covering it with a simple bandage after you've taken away the burning stuff and you put it under water, that would be for burns. Electrical injuries, by and large, domestic currents, you should not get stuck to it, but industrial currents can be quite heavy. So you have to keep yourself safe. You cannot obviously touch the patient there. You need to find safely to get them away from the current if they're still attached to it. Once they're away from it, burns can be electrical burns can be deceptive because you may have a small burn, but the electric current has gone from here somewhere else and come out. So you could have a lot of tissue injured underneath that. So we call it the entry wound and the exit wound. So that will need to be looked at. And if it has gone across your chest in any way, then it could have impacted your heart. So definitely after an electric burn, you need to get medical review done. Management of the burn would it won't be like the other burn where you put it under water. You just get to a healthcare facility once you're separate from it. But nothing specific other than that.
Um, I have a question from someone who's asked about stroke. So they've said that this person's mother had a major stroke, but there was really no symptoms at all. She didn't have any of the usual warning symptoms. 2 years ago, my mom had a major stroke with no prior symptoms at all. She was very healthy. She didn't have the warning signs. So is this something that is possible?
Absolutely. Medicine is not maths. Things can happen randomly at any time. Definitely, we know lifestyle, smoking, alcohol, excessive alcohol intake, recreational drugs, and other things. These are risk factors. What do we mean by risk factors? They increase the chances of you having a heart attack or having a stroke. Do they guarantee you're going to have a stroke? No. We all have family members boasting, he used to drink like this, he used to smoke like that, nothing happened. He lived 100 years. So these are all risk factors. And unfortunately, the reverse is also true. You may have no risk factors. You may actually be doing all the right things in
As,
moderation.
as it was in this in his mother, who says that
Yeah.
she was completely healthy, she exercised regularly, and all.
So it's a body metabolism. It's a clot. It gets formed with various pathophysiology things, and it can happen even when you've done everything right. So yeah, it's actually stroke or used to be called hand of God. So it's actually a stroke. It's just sudden, severe, and you don't
Yes.
always have a warning with it.
So we've discussed quite a few of the emergencies, and I think one thing that our entrepreneurs would like to know is they must be in their startup or in their workplace. How do you really equip yourself with all this? So what should the first aid, or is there somebody who they could consult or get help on uh, what they should equip the workplace with? And what should be on their kit, what should be all the available resources for them.
Yeah, so I mean, like we've discussed various emergencies. By and large, it is bandages and splints and things like that. That would be in your first aid kit. Um, Extrication device. So depending on your workplace, whether you've got something like a stretcher or a scoop or something like that, if somebody's fallen, how would you get them out? Uh, Especially a lot of our, if we are in a high-rise building, the lifts don't always accommodate stretchers. So how would you get them out? So all that would be part of your emergency response. Medication-wise, your simple meds of mainly painkillers, obviously specific conditions, allergies and things like that you could cater for. Definitely, I wouldn't advise directly keeping heart medications like sometimes you might have heard, unless you've got what we spoke earlier about a lifesaver. So ideally, what you want is a lifesaver. You want somebody like first aid respondent in your organization, in your household society, where there are specifically trained people. So you can, and that number is displayed everywhere. Your recognized ambulances number is declared so that they can directly, if somebody has a fall, tumble, you can elevate, put the pressure. Your lifesaver is on the way and your ambulance is on the way. So you need to look at it not just as a kit, but actually the different components. So you
Process.
need a first aid, a process, a first aid responder, and then obviously once you have that, they would control what is in the kit because they will know what is to be done and how it is to be done, and then evacuation from there to the nearest center where you want to go. So I would look at it in that way.
What about drills and other such? I mean, strictly not a medical emergency, but again, something that could cause havoc and disaster.
Yeah.
So they should have some process of fire drills and evacuation.
Yeah,
Depends
absolutely.
on geography too, I think, if they're prone to earthquakes or uh, I don't know,
Yeah. So I
especially
mean
sound.
that again comes under first responder or some kind of mechanism. You can have disasters of various kinds, like you said. It could be a fire, and if you're equipped with fire doors and you know how to contain it, then that would be fire training would have to be given to all your employees how to use the fire extinguisher. Periodically that training needs to happen, and how would you evacuate, whether it's horizontal evacuation, vertical evacuation, depending on the type of building. Other disasters like earthquakes or building collapses, these are all drills that will be very specific. So certainly as a big organization, you would need to have somebody who drives it, because you cannot train everybody on everything, but everyone will have a role. Like, for example, we are a hospital. We are a 400 bedded hospital, and we have HR, we have a pharmacist, everyone. So everyone has a role, and they will do that role when, if there's an announcement on the PA system, it's disaster, there'll be specific rules. So it is again something which needs to be defined for the organization. There has to be an SOP, a manual, and each area would have their own rules to be done at that in that way. That would be the gold standard ideal situation. But yeah, that is how we need to go about it.
I think we already had some questions which had come in. So I'm not going to go into some of the other emergencies that we had planned to talk about unless you would like to discuss a bit about the seizures and about the
Yeah.
allergic reactions if we have some time. But I thought I should bring up some of the questions that our viewers had already sent in. So I think we'll first do that, and then depending on time, we will look at
Yeah.
the other emergencies. So we had one question saying, when organizing residential camps in rural areas with young people, what essential first aid knowledge and preparedness steps should the team have in place? I suppose this is from somebody who does these kind of residential camps as part of their work, their startup.
Uh, Residential camps, young adults. So I think generally it will all hover around cardiac then. Everything to do around the heart. So being prepared, you having an ambulance and first aid responders would be able to recognize whether this is really a heart emergency or it is something else. And again, like anything else, accidents and trauma. So having splints and medications to control the bleeding, bandages and things like that. I think that basically those two areas is what we need to prepare for.
Possibly also to know which is the nearest
Oh
either
yeah,
tertiary hospital or the
absolutely.
men
The closest and how do you get there? Yeah,
hospital and things like that, I
yeah.
suppose. The next question is, what is the correct first aid response for children who are choking or who have insect bites? Choking we already discussed, but insect bites.
Insect bite by and large are self-limiting, as we call it in the medical line. So you will have a lot of swelling. Definitely, there will be pain, and there is a risk of later developing an infection because there is a breach of the skin. So it will be keeping an ice pack or a cold thing on it and seeing a local doctor, depending on where they are. Very small percentage of insect bites can lead to an allergy or what we call a severe reaction where they would become drowsy, their breathing might be affected, so they start wheezing like you're an asthmatic and your chest will get quite tight. So if they have those kind of symptoms and they are getting dizzy where they feel that they're lightheaded and they can pass out, that is an emergency, that is a serious reaction where you need to again get to an emergency department which is well equipped, which you can rely on 24/7. There will be emergency physicians and the quick recognition and quick treatment would become important. Thankfully, it is not a big percentage, only a small percent of insect bites lead to that type of reaction. Majority of them, simple ice pack and getting to a medical professional as soon as possible would be adequate.
Absolutely. This question is something which we might have covered already, but basically the question is, what common symptoms are often ignored across
Yeah.
age groups, which may indicate a serious medical issue? So it's like a very elaborate.
Yeah, no, I think we didn't cover that, and it's actually the most painful part of my job because young adults, particularly indigestion, everything is indigestion. And somewhere the heart attacks get hidden over there. And we are seeing younger and younger people. Doesn't mean, but it's not harm, just to get a medical checkup done, even if it's indigestion. Yes, if you've been diagnosed with indigestion for years and you recognize exact symptoms, that's fine. You know what is to be done. But if you're getting it for the first time or it is different to what you get or much more severe, for young people, definitely heart attack needs to be ruled out. We quite often call it indigestion in the community. In children, generally, there is no delays by and large. Parents are very protective and they tend to bring them in. So there aren't many, not like a common feature that I can touch upon. In the elderly, again, it is a bit of heart attack, but mainly strokes, like you mentioned. The symptoms are very varied and we might put it, oh, they are hypertensive, they have a blood pressure issue, or they have a little bit of diabetes. Maybe it is that they do get, when they get to this age, they get these imbalance issues. So we do tend to do that. So in elderly, that would be one other thing in elderly is the fainting. So if a young person fainting, you may still think a couple of times if they've just seen blood or something serious, scary. But in elderly patients, even sometimes syncope, sorry, is a medical term. It's loss of consciousness, sudden loss of consciousness with a full recovery. So, they may pass out and then they are up again. That in elderly syncope, as in passing out and coming back, and balance issues or any kind of those symptoms are quite often delayed, which is where I stress so much upon in the stroke part, where a lot of things could be done early rather than late.
I think we've really run out of time, but I think Dr. Jagasia, you've given a very, very detailed and very illuminating talk today. And I thank you so much for the practical demonstration as well. So, dear viewers, I think this session would have helped you to understand that the first few minutes, the first hour in any medical emergency is critical. The person standing next to the victim is the real hero, and that could be you. Whether it's a teammate who's collapsing, a child who's choking, a stranger on the street, you can make a huge difference between life and death for them. In those crucial first few minutes, you can be the difference between that panic and protection, between, the catastrophe and reviving a person. So you matter, minutes matter. So do take a pledge today to delve a little more. Let this session be a kind of a beginning point for you to understand more about first aid. Teach it, spread the word, share that people have to learn first aid. So let's just keep learning, keep leading, keep lifting each other up. Because when women are prepared, I think entire communities get stronger. So thank you so much, Dr. Jagasia, for joining this session, and thanks viewers for joining this on behalf of Apollo Hospitals and on behalf of Web. Thank you so much. Stay safe, stay empowered. Till we see you the next time.